This program is intended to be general in nature and should not be used as a substitute for advice from a qualified health provider.
A promising music career sidetracked by medical issues, including type 2 diabetes.
Felt more and more lethargic, and I noticed I started gaining weight.
Over 1 million Americans are diagnosed with type 2 diabetes every year, and many of them never see it coming.
I didn't know what to do, what was next.
We go after the answers and see if life can be better after a diagnosis of type 2 diabetes.
I feel 25 years old, to be honest with you.
Right now on Health Matters.
Health Matters is made possible by our viewers, the friends of KSPS, and by Providence Healthcare.
I'm Dr. Andrew Boulay, and when my wife had a cardiac arrest, I chose Providence because I knew that everything we needed for her complex care was available, from the emergency room to radiology to the nursing staff to the specialists we needed for her care.
I'm Arnie Peterson, and I'm an orthopedic surgeon, and I work at Sacred Heart for Providence Medical Group. When I needed my hip replaced, I chose Providence because of the professionalism and the care that I knew I'd receive. I never thought twice about going anywhere else.
Good evening, I'm Teresa Lukens. November is National Diabetes Awareness Month, and while we are all aware of a disease called diabetes, most of us don't realize how prevalent it's become. Some experts are now using the word epidemic. Last year, the Centers for Disease Control reported that 1 in 4 American adults are living with diabetes or prediabetes, and many of them are unaware of their condition, specifically type 2 diabetes. In the next hour, we will address the signs and symptoms of this disease. We will talk about treatment and, most importantly, how to prevent type 2 diabetes. Joining me for the discussion are Dr. Radha Nandagopal. She is a clinical assistant professor at Elson S. Floyd College of Medicine, Washington State University, and a pediatric endocrinologist at Providence Medical Group and Sacred Heart Children's Medical Center. Dr. Josh Neumiller is associate professor of pharmacotherapy at Washington State University's College of Pharmacy and Pharmaceutical Sciences. He is a certified diabetes educator and is current chair of the American Diabetes Association Professional Practice Committee. Stephen Willis is a certified physician assistant and section head at Multicare Rockwood Endocrinology Diabetes Clinic. And Lisa Randall is a registered dietitian, a certified diabetes educator, and clinical coordinator for Inland Northwest Health Services Community Wellness Center. She also coordinates outpatient diabetes education services for Providence Healthcare in Spokane and is involved with many diabetes organizations, including American Diabetes Association. And we welcome you to join the discussion tonight with your questions by phone, email, or on our Facebook page. And welcome to all of you, and thanks so much for being here. I apologize for the raspy voice tonight. Dr. Neumiller, let's define type 2 diabetes.
Yeah, thank you, and thank you for inviting us. So type 2 diabetes, it's our most common form of diabetes. If we look at all the cases of diabetes, type 2 diabetes accounts for somewhere between 90 to 95% of those cases. So of all the people with diabetes, this is by far the most common. We think about type 2 diabetes being related to what we call insulin resistance. So we have that hormone in the body called insulin that helps get the sugar into our tissues, our muscle, so we can use it as energy. People with type 2 diabetes, they tend to not respond to insulin quite as well because of this resistance. And over time, we see that their blood sugars begin to rise. And that's quite different from, say, type 1 diabetes, where those people don't make any insulin, and they have to be on insulin from the very beginning to manage their blood sugar. So people with type 2 diabetes, they can often start with oral medications, and certainly we think of type 2 diabetes also being very related to overweight and obesity, which is partly driving this epidemic of diabetes. So in addition to the medications, physical activity, good diet, and these other things are very important. And type 2 diabetes, sometimes people still refer to it as adult onset, which is a term we don't like to use anymore because we're seeing more and more of this, unfortunately, in younger populations, kids and adolescents as well.
The numbers are really staggering, Lisa. I mean, it's frightening when you consider how many people, especially walking around with pre-diabetes and don't even know it. Right. Why has it become so prevalent?
Well, like Josh was saying, it's often associated with weight and lifestyle. So we have a culture of very overweight and obesity in our country. We have 2/3 of the country, adult population in this country, are either overweight or obese right now. And since they're very highly related, we are seeing these numbers rise.
Mm-hmm. And Stephen, why do we need to be so concerned about it as a population? I mean, it's obviously scary when it comes to the numbers, but sure. How can it affect communities for that matter?
Thanks for the question. I think that we all know people that have diabetes and live with diabetes, and we see the impact that that plays on their personal life and sometimes on their personal pocketbook. But I think the socioeconomic burden of diabetes in our country plays a role in our overall healthcare delivery. And if we can work with our family and our friends and our patients to improve their quality of life and find ways to lessen the disease burden, it helps that individual, it helps individual families, and also decreases our healthcare burden.
And the costs are in the billions when it comes to...
Staggering, staggering costs.
Type 2 diabetes isn't as prevalent in children, but you do see it.
Yeah, absolutely. I mean, it's actually increasing quite a bit, and we're seeing a lot more type 2 diabetes in children from minority populations, so especially Hispanic Americans, African Americans, Native American children, and Asian American children. And it's not entirely clear why those populations are at such high risk, even at lower obesity rates and lower body mass index. They seem to be at much higher risk of developing diabetes and developing diabetes early. So I agree with Dr. Neumiller that we don't like to use the term adult onset diabetes anymore. Unfortunately, puberty, the age, when children are really growing quickly, there's a lot of other hormones in the body. This is also a time of increased resistance to insulin. And that's when we see a lot of the diagnoses. So we're typically not diagnosing children who are, say, under 10 or 11 years of age with type 2 diabetes, but adolescents are certainly at high risk, and if they already have a parent or a second parent with type 2 diabetes, their risk can be up to 50% of developing it. So it's certainly increasing. Children, we can talk about this I think later, children certainly can present with very acute scary symptoms sometimes, and it's important that people recognize that.
Yeah, in fact, let's talk about the signs and symptoms. First of all, for adults, typically, what will people start to see?
Yeah, and I think with type 2 diabetes, unfortunately, a lot of people go with high blood sugar for a long period of time when they don't have symptoms. And I think there's an issue with people being recognized early, which is why some of the community screenings and other things are so important to identify folks to get their blood sugar under control before they start to have issues of complications and other problems. But these people will have issues with thirst. If their blood sugar is really high, they might use the bathroom, urinate much more frequently if their blood sugars are elevated. Fatigue, they might have blurry vision. So there's a whole host of symptoms, but people might not at any given point in time really attribute that to having diabetes.
But
well,
Lisa?
And I would say too that those are overt symptoms of diabetes that are full blown. I mean, diabetes is a progressive disease, and when we start this process, there aren't any symptoms. Some of the very first symptoms are fatigue right after meals. People say they're tired, they want to take a nap after lunch. So sometimes I see people early on that'll say they have tingling in the feet, but really that's the two symptoms. And those sometimes you can see those even before you can see diabetes, so even pre-diabetes and sometimes even in insulin resistance.
So when you see a patient, as far as the screening piece goes, is that something you suggest that they automatically do?
Absolutely. And I think it's just really important for patients who have family members with diabetes or parents with diabetes to have regular checkups with their primary care provider and mentioning that health information with their primary health care provider so that tests can be run to look for their risk, and their risk can be assessed annually.
And so how will it present in kids then?
So often, about 40% of the time, teenagers with type 2 diabetes are also asymptomatic, and they might go on to be the people who develop diabetes with overt symptoms or because of a screening when they're young or slightly older adults and they've had it for years. But we do see also that some children present with the symptoms that Dr. Neumiller mentioned, which is extreme thirst, urination frequently, sometimes weight loss, but really not that commonly. And they can be quite sick and need to be admitted to the hospital. And sometimes we can't tell the difference between that, type 2 diabetes, and type 1 diabetes, which is far more common in the pediatric population and is because of an autoimmune process where the pancreas is no longer making that hormone insulin. And because we can't tell, and because it's clear that that child is not making any insulin, they have to be started on insulin right away and often stay on it for months to years before we can transition them to oral medication. So in that way, it's a little bit different. And the other thing we know about pediatric type 2 diabetes is that all these complications that we're talking about, so nerve disease, cardiac disease, kidney disease, eye disease, all of those complications seem to be happening a little bit sooner in children with type 2 diabetes if it's not well managed and not well treated. So it's particularly important to catch it early and do something about it and prevent it if at all possible.
Pre-diabetes, exactly what are we talking about when we say someone is pre-diabetic?
Well, it's kind of a spectrum. Like I said, it's a progressive disease, and it starts with what we, well, it starts actually before prediabetes, but when we get to the point where there's prediabetes, it's based on numbers of blood, the amount of sugar in the blood, either fasting or after a glucose load or just a random. But so it's progressive, but those numbers will determine kind of where you're at on the scale. So prediabetes is associated with a certain A1C and a certain fasting blood sugar. And then if you aren't changing lifestyle or getting some kind of treatment at that point, which there often is not treatment in prediabetes, it will progress to type 2 diabetes much of the time.
So what kind of things can you do if you're pre-diabetic to sort of get a handle on the situation?
Well, it's funny because I'm a dietitian, so I always say, you know, food and diet is very important, but in prediabetes, actually, exercise is the key. Exercise is magic for prediabetes.
Really?
In helping prevention.
I would have guessed diet right out of the chutes. Huh.
Yeah, well, diet is important.
So when it comes to treatment, then it depends on how you approach treatment, where you are on that scale then?
And
so
what the patient's going to buy in on.
Yeah.
Where's that patient in the process, and what's the patient's belief, and how motivated are they going to be to make that change?
Is that the biggest challenge you see?
I think education is the key. As a certified diabetes educator, you guys can definitely chime in on this, but I think it's getting that patient with prediabetes in an education class or one-on-one with a provider where they can really understand the process and potentially make a change.
Do most people just want to tackle it with a drug instead of, and ignore the piece that they can do?
I mean, that's our culture, I think.
Yeah.
You know, what can I take a pill? It's easier, I guess, but even in pre-diabetes, you know, we have some very nice studies. Diabetes prevention program was a landmark trial that actually showed lifestyle, physical activity, and better diet is better than any drug we can give somebody for most individuals. But there are medications like metformin is one medication that you can see used in people with prediabetes. And you know, if you use that in combination with those physical activity and dietary interventions, that can help prevent people from developing type 2 diabetes as well.
What are the dangers of ignoring a diagnosis or of not recognizing the signs and symptoms and seeking treatment? What can happen?
Well, if somebody can become very sick pretty quickly, and prediabetes leading into type 2 diabetes increases a patient's risk of infections, so they're going to have a higher rate of developing infections that can be harder to manage. And the sooner we address, diagnose, and treat diabetes, the easier it is to manage long-term, typically with less medication burden. So the earlier we catch it, the better quality of life that patient may be able to have.
Mm-hmm. And there are some fairly drastic risks as far as amputation and blindness, those sort of things that can happen?
Yeah, and those are more long-term risks, so we try to keep people under good control for a long period of time. If somebody lives with fairly poorly controlled diabetes for years, 10 years, they might develop some of these complications like eye disease, kidney disease, and nerve damage that can lead to very bad problems like ulcers on the feet and potentially eventually amputations, which is what we definitely want to prevent.
And I think that that's a really important point, and also one that we shouldn't forget about is that none of these complications are inevitable, and sometimes families can feel that way. They watched grandma have amputations, or they watched their grandfather go blind, and so that must be what it's going to be for me, so why try? And our care is better now. We know a lot more about prevention, and that's what I try to talk about with teenagers who are newly diagnosed with diabetes or who have pre-diabetes, that there's actually hope and that you can do something about this. And sometimes that's the first time they've really thought about it that way, because they just see it as sort of inevitable. And then I think the other side of this is that it's an easy disease for a while to kind of ignore, and teenagers are particularly good at not looking past their noses, and so if they ignore it and they maybe just don't take their metformin, I mean, what's really going to happen? They don't really see what's going to happen. They're not thinking about the long-term consequences. I often joke with my pediatric patients that that's why car insurance rates are so high for 16-year-old boys, because they don't think about the consequences of not putting on their seatbelt or of speeding. And so similarly, it's really hard to talk to a 17-year-old about the potential for blindness, and to get the whole family on board with knowing that this can be prevented. And in the pediatric population, that's really critical. We just don't have success unless the entire family, whoever's in the home and whoever is responsible for the care of the child, is also on board. It's really not an individual choice.
Yeah, it has to be a family choice.
It has to. It absolutely has to.
Yeah.
For both exercise and diet.
And have you seen people tackle that
Absolutely.
as a family?
Yeah, no, the families who are successful, who get the blood sugars under control and get healthy, are the ones where they make a sea change with small steps, but they make a change. And the whole family makes the change, and it's usually better for all of them. And sometimes we see parents' A1Cs get much better as they're thinking about their kids.
Mm-hmm. So what's the culprit when it comes to food? Are we eating too much sugar? Processed foods?
Well, that's one thing that people say when they come in for diabetes education. They're like, I quit eating sugar. And it's like, well, sugar is part of it, but carbohydrates in all forms. And I tell people in pre-diabetes, it's not really about counting carbohydrates and all of that. It's really about weight loss and exercise. That's how you prevent the progression to type 2. But once you have diabetes, then you don't have, or you're not using insulin as well, and so you don't metabolize carbohydrates as well, so you have to control them. I kind of say you put them on a budget. They're on a budget. So we like to eat carbohydrates, right? Carbohydrates are our favorite food group, kind of. So it's hard because and there's a lot of misinformation about carbohydrates, right? Because right now there's a lot of low carbohydrate diets, high protein diets, and our bodies need carbohydrate. They just need good carbohydrates. And so what is a good carbohydrate versus a not good carbohydrate? Oftentimes sugar is associated with not so good carbohydrates, but we have sugar in fruit, right? And fruit is very healthy, very good for us. So it's just, we put carbohydrates on a budget, and we also choose, make good choices within that food group. So.
We have an email coming in from Holly in Moses Lake. She says, can hypoglycemia be an early indicator of a person developing diabetes? Josh?
Boy. On the hypoglycemia end, if somebody's coming in and complaining about or reporting hypoglycemia, really with diabetes, we're looking at elevated blood sugar if they're not on medication. So I would encourage that person to be seen and try to figure out what's going on resulting in those low blood sugars. There's probably something else going on.
And recognizing what really hypoglycemia is. In the endocrine clinic, we'll see patients with concerns for hypoglycemia, but when we actually test their blood sugars, they're not truly in that hypoglycemic range, which is blood sugars typically less than 60.
And I don't know how old our emailer is. I'm assuming not a teenager, but sometimes early type 1 diabetes can show up with hypoglycemia. But again, I would echo that she should probably see a doctor and really get that checked out. It would be very unusual for it to be type 2 diabetes.
Okay. As we mentioned, a lot of people with diabetes or pre-diabetes don't even know that they have it. That was certainly the case for a Spokane musician whose already hectic lifestyle was complicated by some other medical issues. And when his diagnosis of type 2 diabetes came earlier this year, it came as a shock.
I'm Barry Lee White. I'm a country music and country gospel artist, born and raised in Spokane Valley, Washington.
Not long ago, Barry Lee White's star was on the rise as he chased his dream in Nashville.
I don't get down on my knees.
The band was called Moonshine back then. We opened for Hank Jr. and Johnny Cash here and Diamond Rio, all kinds of stuff.
But things got sidetracked in 2013 when he suffered a brain injury that has taken him down a road he never would have imagined.
The brain injury was 5.5 years ago, and it changed my body, and we didn't know till recently it was actually the pituitary gland that got messed up as well.
That led to another problem that was not discovered until earlier this year.
I just felt more and more lethargic, and I noticed I started gaining weight.
Barry's primary care physician ran some tests.
She did some blood work 3 times, and she's watching the sugar, the A1C levels rise within 3 months, 6 months, and she was confused and concerned.
The diagnosis, type 2 diabetes, came as he was completing a long rehab from his brain injury, and it hit Barry hard.
I didn't want any more. In fact, I'd had enough already with my brain, and so it was a huge blow for me. I was depressed. My wife noticed I was down because I didn't know what to do, what was next.
But what happened next made all the difference.
Within a month, I'm down 30 pounds and feeling like a kid.
So Barry, how have you been doing with your diet?
Barry was connected with a diabetes educator who gave him a roadmap to a healthy life through diet.
It shows all of the diet, things that you can eat, things that you maybe could eat, and things that you shouldn't eat, and we followed that.
Barry's wife, Lori, has taken over the meal planning and preparation.
She's an awesome cook.
And Barry has found there is a broad culinary world beyond the hamburgers he used to crave and the root beer he says he was addicted to.
Knocking all that stuff out, it changed my life. I think clearer, even with my brain injury. I can make decisions quicker. It's like it was like a poison.
Barry meets regularly with his educator, and that accountability has helped him stay on track.
She can tell by looking at me. You're not going to pull anything over her, and we've been following that diet.
He doesn't need injections, but in just a few months, a daily oral medication and regular exercise along with the diet have made a huge difference.
I feel 25 years old, to be honest with you, and I'm 53. This helped clean my head up and clean my body up so that I'm ready for the next go around here.
And the next go around means he's back to chasing that dream that got sidetracked.
I'm going back in December to do what I was supposed to do. The first move to Nashville 22 years ago. I'm cutting a country gospel record. I feel like I've licked it, and I'm going to continue to lick it.
It don't matter how far I might wander, he's my silent partner.
So Lisa, talk about the education piece. That is what Barry said has made the huge difference for him, is having that accountability.
Mm-hmm. Well, accountability, and we talk about diabetes education as diabetes self-management education, because people really need to own this and take care of this themselves, because it is so associated with lifestyle choices that we make every day that you have to really be educated about what the benefits are of those choices that you can make. So we teach about nutrition, we teach about exercise, we teach about monitoring blood sugars, we teach people about how their medications work, why they take them, when to take them, what happens when you're sick. So we teach a lot about just managing, how they can self-manage their disease. And the more they know, the more they become empowered, and the more they can understand what decisions they make, how that impacts their diabetes.
Excuse me. This cold is really kicking me. it was difficult for us, Lisa, to find someone who wanted to step up and do a story for us, simply because they were embarrassed by their lifestyle choices.
Yeah, and I think there's a lot of shaming that goes along with this disease, and you know, we try to take away the blame, because it's really not about blame. Honestly, we have a very toxic culture when it comes to food and when it comes to exercise. You know, we have a lot of conveniences in our life that make it easy for us to not have to work very much. I tell people, you know, our bodies, we're meant to starve and we're meant to work. That's how we're designed as human beings, like, you know, centuries ago. So we have a culture now where we don't have to work for our food. We have a lot of available, inexpensive food that is not very good for us as far as prevention of diabetes. So we have to learn how to eat again. You know, when I first was a dietitian, we were taught, you know, that people make intuitive good health choices and food choices, but I don't really believe that anymore. We have to learn really how to do that.
It's also thinking of food as a source of nutrition rather than a source of pleasure. Right. And how you want your body to respond long term. And when we eat for pleasure, sometimes our body, when we eat for pleasure all the time, sometimes our body just doesn't respond well.
Okay. We have Val from Edmonton calling. Hi, Val. Thank you for calling in.
Hi. Yes. Well, we're talking about diabetes. I have something that's opposite to being a diabetic. My body's producing too much insulin, and of course it's all has to be monitored by diet. And you know, as soon as you have any carbs, I have a reaction. And I just wondered if the panel has any suggestions for me other than watching my carbs. But everything that you pick up or in the store that you want to buy, food-wise, you know, everything has carbs. So it takes me forever to shop for groceries. And I live by myself, so I have to learn how to cook accordingly, and I'm having a difficult time with it. And each time I eat too many carbs in a meal, within 15 minutes, I am so weak I can't function.
The shopping and just cooking for yourself and making sure that you're doing the right thing.
Well, and Josh can probably talk to this as well, but that's very common in prediabetes and early diabetes, is you're making a lot of, well, prediabetes certainly, you're making a lot of insulin. You're making a lot of insulin to do the same job. So high insulin levels, but that insulin isn't working, right? That's why you have to make more insulin. So blood sugars do go high with that. But exercise is really very powerful for that, as well as the portion sizes, as well as food choices.
Sounds like in our caller's case, she has hyperinsulinism, and I'm just hoping that she's sought care. It's a pretty rare disorder and needs a good workup. So seeking care with an endocrinologist would be really important, and hopefully then they can walk you through how to get the right kinds of foods, what the next steps are, because it doesn't sound very comfortable what she's going through, and food should not be something she's scared to eat, and she's clearly sounds like she's gotten there.
Struggling with that.
Right. So I'd really encourage her to
have a thorough evaluation with some lab testing to evaluate why she's having low blood sugars after eating relatively healthy meals. It's a bit of a concern, Val. I hope you can get some help with that.
Yeah.
Where are we at research-wise when it comes to type 2 diabetes? That's something you're heavily involved in.
Yeah, it's an exciting time. As you mentioned on the front end, I currently sit on the ADA Professional Practice Committee that develops the standards of care for diabetes each year, and we've been really excited over the last couple years with all the new trials that are coming out. So with all of these new medications, which it seems like there's more medications coming out every time you turn around, but all these medications have to undergo cardiovascular outcome trials to basically show that these medications are safe in people from a cardiovascular standpoint. And many of these newer trials with some of our newer agents are actually showing not only that they're safe, that they're actually contribute to benefit for people to prevent cardiovascular events. And also another exciting area is some of these medications are actually showing that they can help prevent people from having worsening kidney disease over time, even in people who already have some degree of kidney disease. So some of the treatment guidelines are evolving now, moving more towards what I would say is more individualized medicine, where we actually look at what other conditions people have and where we might be able to not only help with their blood sugar, but also help with their cardiovascular risks and their kidney disease, as well as other areas.
Mm-hmm. And do we typically see people with diabetes then that have a lot of other health issues?
Oh, absolutely. You know, we type 2 diabetes in particular, these people often have blood pressure problems with cholesterol, and a lot of them over time do have heart attacks and other events. And so really, what can we do to help prevent another event? Some of these medications are showing that they can be helpful in that regard.
Mm-hmm. For a lot of people, Lisa, is it sort of a switch that's flipped once they start getting into a healthier lifestyle? Maybe they start the exercise first and then the eating healthier, and suddenly it's, you know, Barry mentioned in the story that we saw, you know, that his thinking was clearer, that he felt less foggy, he'd lost 30 pounds. It just seemed to, and he was excited about that process.
Mm-hmm. Yeah. Yeah, well, and you know, one thing is changes don't happen overnight. So they're usually gradual changes that people make. But when people understand what affects their blood sugar and how they can feel better, then that helps them make more changes. So teaching people or having them really realize, you know, oh, when I do this, I feel better, or when I do this, my blood sugars aren't as high, and then they can feel empowered. And when they feel empowered, then they are more likely to make more changes. And that's a lot with what diabetes education can help people with, because we spend a lot of time teaching that.
Are people surprised when they're diagnosed?
That's one of the first questions I ask my patient. When I see a new patient for diabetes, I ask them when they were diagnosed, and then my next question is, were you surprised by your diagnosis? And I would say probably 75% of the times they'll say yes. But then when I ask about family history of diabetes, there's frequently a family member or there was a close relation, family member that had diabetes, and we talk about the path that led to the diagnosis. But there's often a point where people just don't want to accept that. And so they're just not willing to accept the fact that they have the diagnosis of diabetes.
Mm-hmm. And then are they willing to trying to turn it around with education? And
that depends on the individual.
Yeah.
Some people they want to make every effort when they've got a good motivator. They'll make every effort to improve their lifestyle or find the medications that work for them specifically. Some people walk away from that diagnosis until they have a problem, and then they come back and they'll get the attention that they need when they want it.
Mm-hmm. Harder to turn that around for kids?
Yeah, it really depends on the family dynamic. You know, sometimes we have parents who are really pushing the change, but if you've ever tried to get a 17-year-old to do something that he doesn't want to do, it's pretty difficult. And so the child really has to want to change, but so does the whole family. And then sometimes we do encounter, especially with our lower socioeconomic status individuals, that, you know, they live in food deserts. So even if they want to pick better foods, it's harder for them to do so. Mm-hmm. And it's easy to just kind of give up on that choice. So they don't have a supermarket that has a whole lot of fresh vegetables and choices other than bags of chips. And it really takes for the whole family to decide, we're not going to have the bags of chips in our house, because if I have the bag of chips sitting there, I'm going to eat the whole bag of chips. And that's a really difficult kind of conclusion for lots of families to come to. And often what we see is parents really want their kids to change, but the kids aren't quite there yet. And so it does take some work.
Do you see parents too that don't want to change, but they want to try to change
Certainly.
The kids?
Or we might see one parent who wants to change, the other parent doesn't want to change in a two-parent household, and then the child is sort of stuck in the middle, or might be at mom's house and gets one diet and goes to dad's house and gets a different diet. And so that can be a real struggle. All the family dynamics certainly come out.
We have another email from Ivar, and he says, what is the effect of going on a plant diet without meat for a type 2 diabetic?
I think that's a great question. I think that when we start looking at eating more healthy, our body's going to benefit from that. I think that we do need protein and balance that diet in protein and a plant-based diet, but just ensuring that you're getting adequate proteins, lentils and beans from a plant-based diet is really important.
I mean, I can speak to that as a vegetarian. My family's heritage is from a place with, 40% of the population of 1 billion are vegetarians. So a plant-based diet has been shown through some studies also to actually reduce the rate of diabetes and to reverse a lot of the effects of diabetes. And it's with thoughtfulness. So a teenager who comes to me and says, I want to be a vegetarian and I've decided I'm just going to eat spaghetti with tomato sauce all the time, that's not a great diet and not a great choice, even if you're not going to be a vegan or a vegetarian. But if you have a balanced diet, as much of the world's population does with vegetarianism, it can be absolutely fine in terms of protein. It takes away a lot of the risks that come with red meat, especially. And that can be incredibly healthy. And it also reduces your risk of a lot of other things, like cancer.
Yeah, and the reason it does that is because a lot of, there's just a lot of nutrition associated with plant-based foods. Absolutely. So there's a lot of phytochemicals, there's a lot of antioxidants, vitamins, minerals, and fiber. And fiber has been very helpful in helping reduce postprandial or post-meal blood sugars. So that is probably one of the biggest bangs for your buck for a plant-based diet.
Okay, we have a phone call from Rick in Polson, Montana. Hi, Rick.
Hello.
Thank you for calling.
Yes.
You have a question?
Yes, I do. Well, not a question, actually. I heard the gal call just a little bit ago, had hyperglycemia, and she was wondering what to do, and they really didn't give her much of a thing. Actually, the best thing she can do is watch how much carbohydrate she does eat. She has to eat lower carbohydrate. But I've heard that chromium does a very good job for hyperglycemia. And so I just thought that, I heard her ask the question, and I just thought that would be a wonderful thing for her to know and look into.
Well, thank you. I appreciate your comment. Can someone speak to what Rick just mentioned?
I think that comment was on chromium.
Yes.
And chromium is a mineral, and there are some small reports that show that chromium might help to lower glucose levels in very small amounts. But the evidence-based studies really don't show that chromium is going to make a significant difference for the diabetic person in lowering glucose levels from an evidence-based perspective. When we're looking at placebo-based trials with something like chromium.
Are there any other supplements or vitamins that would be good to include in your routine?
I'll let Lisa go on that. You're the CDE.
Well, I mean, if you have a well-balanced diet, there are, certainly a multivitamin is helpful. There are a lot of supplements out there that have a lot of associations with it. There's cinnamon, there's a lot of them. And like, you're saying, they for someone who has, severe hyperglycemia, then that isn't going to be enough to control blood sugars. It can help, and it might help, in that prediabetes range, when people don't have severe hypoglycemia. It's not going to hurt. They're not bad things, but to look at it as a way to control blood sugars is probably not realistic. We do have a lot of very good medications right now that are fabulous. Yeah, and like you say, they target different areas, so they're very helpful for that.
And I think the only other thing to add for our caller is that previous caller had been suffering from hypoglycemia, and I think that distinction is really important. She had low blood sugar rather than high blood sugar, so we wouldn't want to give her a treatment associated with high blood sugar, and that's why I think we all agreed that she should really seek some medical care.
Okay. We have Cliff. Hi, Cliff, from Spokane.
Yes, I'm 80 years old, and I was diagnosed with prediabetes about 2 years ago, and I'm taking metformin as a result of it. But one of the panelists mentioned obesity is one of the main culprits, but also mentioned that some ethnic groups, like maybe Asians, are not necessarily obese, but become diagnosed with type 2 diabetes. And I was wondering, I read somewhere where organ fat might be a contributor more so than maybe outer body fat. Is there any evidence that that would be the case? Because my body type, I would consider, I have what you would consider a beer belly. My arms and legs are thin, but I'm overweight.
Thank you, Cliff.
Yeah, I think that's a really good question, and central adiposity does increase the risk of developing hyperglycemia and diabetes. But to your question, I think it's really important for us to recognize that in the senior population over the age of 65, 25% of that population has type 2 diabetes or prediabetes. So as we age, we just have a greater risk of developing type 2 diabetes in our culture and society. And you might not be overweight or have an obesity problem and still develop type 2 diabetes just as a result of our lifestyle in this society. And then there's such a strong genetic and family link there too.
And too, Cliff, the fat layers that pile onto our organs absolutely increase risk. So you can have a normal body weight, but if you have central or abdominal fat as opposed to mainly around your hips, you are at a higher risk for type 2 diabetes, and that risk starts even when you're a teenager.
Do we see that more in men than women, or does it matter?
No.
Not necessarily.
No.
I mean, in teenagers, it's much more common in girls than in boys, but I think that probably evens out.
And that's a very good way of kind of indication is waist circumference. So we know that high waist circumference is associated with type 2 diabetes and prediabetes.
Okay. We have Ishtik from Alberta. Ishtik, am I saying your name correctly?
Yes, that's right.
And you have a question?
Yes. The question I have is, it seems to be that nowadays the number of diabetics around the world has dramatically increased, and it seems to be every fourth or fifth person is involved with diabetes. So should the new diabetics be hopeful that in coming decades there would be likely something or some sort of research coming up that could revitalize their organs and bring them back to normal rather than living on to the medication day in, day out?
Dr. Neumiller.
It's an interesting question. Yeah, I mean, I guess on the question wasn't related to medications. I know on the medication side, you know, we are looking at different medications that can help prevent further weight gain and really address different targets to manage the diabetes. I'm really struggling to think of other research or interventions that try to get around and address this issue outside of the medication aspect. I don't know if either of you
know.
are
One in 10 Americans has diabetes, type 2 diabetes, so the numbers are high, and I think recognition and prevention is key. But with regard to research and some of the reading I've done, what's really fascinating is some of the research in early pediatric type 1 diabetes for prevention. I think there's some really fascinating research happening there. But in the type 2 population, it's primarily trying to improve that lifestyle and healthy eating and healthy weight maintenance.
And we do know it's growing around the world. And I don't know if our caller is from South Asia, but that's an area that is really seeing a huge rise in type 2 diabetes. And what's interesting is while we're seeing it in minority populations in the United States and sort of lower socioeconomic status, what's happening in other countries like in India or in Pakistan is that diets are westernizing, and as they westernize, it's really the higher socioeconomic classes that are really seeing this really profound increase in type 2 diabetes. So the research, and the World Health Organization is actually looking into all of this, but the research is really focused on the public health interventions to try to go back to what we used to eat and move the way we used to move, kind of some of the ideas that you had brought up earlier, Teresa. So that's really, I think, where the public health research is going.
And the thing with type 2 is that it's so multi-organ related. It's not like you can fix one or two things. It's like it's, you know, related to a lot of different things that is basically metabolism. So it does come down to eating and exercise.
And there are studies that, you know, bariatric surgery, I didn't know if that was going to come up today, but can reverse or even put diabetes into what the surgeons will call a remission. But is that socioeconomically viable for most of the world? Probably not. And for most people. And to go through that sort of a surgery and everything that comes with it, that's probably not a viable public health solution, but we know that something exists. And so using that and using that knowledge to figure out what are other ways that we can reverse type 2 diabetes is probably another future direction, and I know one that people are studying.
Absolutely.
We have Kimberly with a phone call. Hi, Kimberly.
Oh, hi. So I just wanted to make a comment on the type 2 diabetes, and I did find a supplement that has worked, and I found to lower blood sugar, and it was Fenugreek, and I have taken the supplement, and I've seen that it does cause a low blood sugar, but it does support the digestive system. So I just was kind of curious to see if how they did any studies on having like more of a digestive outlook on how to control the diabetes.
That's a good question. I think one of the areas of research I'm really fascinated with is the gut biome and changes in the gut biome, and what we're finding out in research with healthy individuals, and we look at the flora in the GI tract and how certain populations of people have different bacteria, and we're finding that that is making a difference in who gets type 2 diabetes or not. And that's just really evolving or emerging research. But I haven't personally read much on, I think it was Fenugreek, and how that can affect glucose levels. But that's interesting.
Well, and there's a lot of food. I mean, food is kind of what regulates some of our metabolism, right? And so we have these hormones that are part of our repertoire of medications that are hormones as well. So these incretin hormones are these gut hormones. And you know, food can impact that, and that's part of the benefit of the fiber in the plant-based diet, is those are feeding that microbiome and making that a healthier, your healthier gut, and helping your metabolism work the way it should.
Yeah, well, we're seeing that related to a lot of diseases and conditions now. Right. The gut, yeah.
Absolutely. I mean, I like to tell my patients who want to start cinnamon or fenugreek that absolutely there's really no harm to those, and those spices are used in a lot of especially Asian and Mexican cooking, so it makes sense, and if you want to take it in a concentrated form, you're welcome to. It's pretty expensive though, and you know, I kind of asked them to sort of trial it for a while, and certainly with severe diabetes, it can't be the only thing. So I think that's really where we have to be a little bit cautious about what we recommend.
And the balance in using those. Karen from Victoria, BC. Hi, Karen.
Hi. I have a question about intermittent fasting. I have had numbers that I'm having trouble, I'm having trouble controlling eating, and therefore my numbers for a while, and I'm type 2 diabetic, and I'm curious about intermittent fasting and wondering if that might help block the eating and start to help me get things under control.
That's an interesting topic, and I think that there's several different ways that intermittent fasting is defined. And I see some people refer to intermittent fasting where they're going to eat the first 8 hours of the day and then refrain from eating after that. So if they wake and have a morning meal at 6 a.m., they'll eat for the first 8 hours of the day and not eat afterwards, and they find that their blood sugars are easier to manage and they're able to maintain a healthier weight. And there's also some interesting studies on intermittent fasting where people might skip eating 1 or 2 days a week. But these are very small studies, and I really wouldn't recommend that for the average individual. And that's something where you should really meet with a nutritionist to help guide you and your healthcare provider on the health benefit or risk of that.
Lisa, your thoughts?
Well, the benefits of that is that you're not eating all day. So it really restricts the time that you're eating, and it puts your body in a state of fasting when you're done eating. And that's advantageous because then insulin levels drop for people that have high insulin levels. So it has some merit, I have seen, but it is not for everybody, and it isn't a, the thing is there's lots of people that have different profiles, right? They come in, they have different issues, they have different lifestyles, they have different cultures. So it may work for some people and it may not. But I do think that especially eating after dinner at night avoiding that is very helpful for people with type 2 diabetes.
And I would just add, I think very interesting research on intermittent fasting. But as far as the skipping like days of not eating, I've had a couple instances where I've worked with people who are on, say, insulins or medications that we call sulfonylureas, and they had very bad low blood sugars. So before you do any of these kind of dietary, changes, talk to your provider. Make sure you're doing it safely.
Rosemary in Alberta. Hi, Rosemary.
Hello. How are you this evening?
Very well, thank you.
Okay. I'll explain. My husband has a disease that the doctors put him on prednisone. Now, the prednisone gave him type 2 diabetes. He takes metformin and Januvia. My question is, should he be on a diet to help the type 2 diabetes, or is it necessary? Does the metformin and the Januvia do enough to control the diabetes?
So if you look at the guidelines, either from the ADA or any organization that is supporting diabetes, the first line of treatment is lifestyle. And lifestyle is primarily food, diet and exercise. But medications are there to help the process or to improve the process, but diet is primary. So diet will help anything. That will always make it better.
I think that caller brought up a really interesting question that I see occasionally in my practice, and there are numerous illnesses where patients need steroids. And sometimes high-dose steroids are needed for an extended period of time for certain inflammatory disorders. And those glucocorticoid steroids can induce type 2 diabetes, and it can be challenging to manage and maintain. I would say if your husband's blood sugars are controlled with the guidelines of the healthcare provider that's seeing him, the metformin and Januvia are good, reasonable options as long as the blood sugars are at goal for that individual. And I think we need to individualize our glycemic targets for our patients based on age and other comorbidities.
What is the highest growing population of diabetics right now, as far as age group?
Boy, that's a good question.
Well, for type 2, it's above 65. The numbers are staggering.
25% of the 65 and over population are developing type 2 diabetes.
Mm-hmm. And 1 in 2 have prediabetes. And most of them are undiagnosed.
And that goes to, do we know why that population is so high?
Well, we all produce less insulin as we age. So as we get older, if we had a tendency towards it as we were younger, when you put lifestyle on top of that, then as, like our gentleman that called that was 90 years old, that, when I first started teaching nutrition and diabetes, I would teach, generally women in the hospital who are 80 years old. That was my population. Now my population is 45 years old, So that was a while before we had as much toxic food supply as we have now, right? I think that was many years ago. So the majority of people diagnosed are going to be older just because we make less insulin.
Okay. Do we need to start this in schools, education?
Yeah.
Does this need to be part of the curriculum?
Yeah, yes, I would say that as a pediatrician, but certainly there is more and more information for kids about how to choose foods wisely, to keep moving. So all of those are really important public health interventions. And then ultimately, we have a lot of other sort of social disparities to fix, right? Food deserts, why do some kids get access to care and some don't? So those are all things that I I don't know that I can fix personally in my clinic, but the things that we can really help families with is working together to make these preventions early so that they're not dealing with the complications of diabetes when they're 30 or 40 years old.
Follow-up. Do people follow up with their care? Do they get a diagnosis and not follow procedure and do what they need to be doing? The follow-up piece.
Sure. I would say that most patients are really good with following up on their diabetes care, and for the adult population that we typically see, we recommend follow-up on type 2 diabetes at a 3-month interval. We want to closely watch blood work looking at their kidney function. We want to ensure that that patient's getting a dilated diabetic eye exam annually so that we can look and see if there's any microvascular changes occurring and monitor blood pressure and cholesterol, because all of those things add up to really tell us the health of that patient, and we can make interventions along the way and change as we go.
All right, Phyllis in Alberta. Hi, Phyllis.
Hi. Yes, I have a question. I have a dear friend who her symptoms are such that she wakes up in the morning and she is quite blind. It wears off through the day, and then it repeats itself. I have a lot of diabetes in my family, and my grandma was blind for 10 years. I'm just wondering, could this be in connection to diabetes? She's had several ophthalmologists who do not know what is going on. Could this be a problem connected to diabetes?
Did the caller state the patient wakes up with inability to see in the morning?
Yeah.
That's a tough situation there, and I think that person really needs to get in to see their healthcare provider for a thorough evaluation, and just can ask about having their glucose levels checked. But I think there's more to that than just blood sugar and possibly diabetes.
And if she's seen an ophthalmologist, they would be able to recognize diabetic-related eye disease. So yeah, I would say get in to see a primary care doctor and start fresh.
No, so that is something an eye doctor could spot?
Yeah.
What would they see?
So they would look in the back of the eye.
The retina, and you'd see damage to the vessels in the back of the eye.
So that's something that you want to pay attention to too, then, when you go to the eye doctor.
That's one of the earlier things we'll see with vascular damage in diabetes patients, is that retinal eye exam is very important for evaluating the vessel health of that individual.
And we even start referring children who are diagnosed with type 2 diabetes for eye care and screening.
Okay, we're getting close to the end of the show. A few seconds on final thoughts on the topic of type 2 diabetes. Josh?
Yeah, I just thank you for having me. This was enjoyable. And I guess one thing that really struck me during the conversation is that this is a process. You know, people develop type 2 diabetes over time, and we talked about being motivated and the like. So I would just encourage listeners to celebrate small things they achieve. You know, you don't have to fix everything by tomorrow, so make small changes and you're making progress and doing good on your health.
Very good. Well, that will do it for this edition of Health Matters. Our thanks to everyone who called in or emailed a question, and a big thank you to our panel for being here and sharing their expertise. Join us on December 20th when we will talk about one of the most preventable health issues facing communities. That's domestic violence. Until then, I'm Teresa Lukens. Good night.
Health Matters is made possible by our viewers, the Friends of KSPS, and by Providence Healthcare.
I'm Dr. Andrew Boulay, and when my wife had a cardiac arrest, I chose Providence because I knew that everything we needed for her complex care was available, from the emergency room to radiology to the nursing staff to the specialists we needed for her care.
I'm Arnie Peterson, and I'm an orthopedic surgeon, and I work at Sacred Heart for Providence Medical Group. When I needed my hip replaced, I chose Providence because of the professionalism and the care that I knew I'd receive. I never thought twice about going anywhere else.